Welcome. This video is about the Adverse Childhood Experiences Study, often known as the ACEs study. The ACEs study is an extremely important research study that is just beginning to get as well known as it should be. So how did the ACEs study come to be? The study arose out of a partnership between Kaiser Permanente HMO Insurance Company and the National Institute of Mental Health. It started because some scientists at Kaiser were concerned about why excellent health improvement programs that they were offering to their patients were not creating lasting change. And they became interested in the question of trauma and its effect on people. So they had a captive audience of about 17,000 people. And they gave each of their people a simple 10-question questionnaire. Now, you have to look at who these people were. They were all insured, and they lived in California. They were not representative of the general United States population. For one thing, the median age was 57. They're a high-functioning group, all working, all insured, large percentage of middle and upper middle class. Lower percentage of people of color, 74% had attended college, so not representative of the general population. The 10-question questionnaire they were given, these were the things that it asked. And it just asked, did this happen to you when you were a child? Not how often, not how severely, just yes or no. So you scored yes or no to these 10 things, and you ended up with an ACEs score from 0 to 10. The findings from this study were possible because this is an insurance company. So they had all the health outcomes of these 17,000 people. And so they were able to compare the number of ACEs and the person's health outcome. First of all, they were shocked by the high prevalence of adverse childhood experiences in this population. At least 64% of the people had at least one ACE, at least one childhood experience. 12% had 4 or more ACEs. About a quarter of the people had substance abuse in their home. About a quarter of the people had physical abuse. So ACEs were very prevalent even among this population. Then the even more amazing outcome was that there is a strong linear dose-based correlation between the number of ACEs someone has and negative health outcomes. So in other words, the more adverse childhood experience you had, the worse your health outcomes in adult life are. For example, people with more ACEs were much more likely to attempt suicide. They were more likely to be alcoholics. They were more likely to be depressed. This shows you 6 times more likely to commit suicide, 7 times more likely to be alcoholic, 7 times more likely to have sex before 15, 46 times more likely to use injected drugs if you've had 4 or more adverse childhood experiences. This shows you the difference between none and 4 or more. Well, those things you might think, well, those are things you'd expect to have happen with somebody who had a difficult childhood. But what they found was that the negative health outcomes continued to areas that we don't usually think of being determined by psychological factors. So the same dose correlation happened between the people with heart disease, people with lung disease, obesity. So the moral of this story is that stress has a lifelong impact, that there are various areas of our body that are affected by early childhood trauma, and those areas then affect our vulnerability to negative health outcomes. How does this happen? There has been, since the ACEs study, quite a lot of thinking about how does this happen. And there's various mechanisms, some of which have to do with the body chemistry, the effect of stress hormones always being present, Some of it has to do with the immune system being weakened by exposure to chronic stress. And there's various other cellular events and activities that impact our ability to fight off negative health problems. So it turns out that people with 4 or more ACEs are twice as likely to have cancer as people with no ACEs. They're also twice as likely to have heart disease. So this will show you the difference between no ACEs and 4 or more. Since the time the ACEs study was done, it has been repeated in many places, in many cultures, many circumstances. And this same correlation between ACEs and negative health outcomes has held for all the populations. This study compares the original population, which is in the lighter blue, and juvenile justice people who have females who were in juvenile justice facilities. So you can see that those people in the juvenile justice facilities have more ACEs than the original population, as do incarcerated men. So this is showing us that in those places where we think people would be more likely to have more ACEs, in fact, it is true. Women raised in foster care tend to have a lot more ACEs than this original population does. So the ACEs study is very important, but there's more to it, more things that we need to learn, more ways we need to investigate. For example, it's been pointed out that the ACEs study does not include some very important types of trauma. It particularly focuses on what happens within the home. It does not have any questions about racism, community violence, your environment that you live in, your school, none of those things, bullying, nothing that happens outside the home is mentioned in this study. So you could have your best friend shot in front of you and it wouldn't affect your ACEs score, but of course it would affect your real life. Some places have added 4 or 5 questions to a supplemental scale to bring that part of trauma into the study. Another interesting thing about the ACEs study is that the assumption is that it's worse to have several types of trauma happen to you than to have one really bad one. So for example, if your uncle touched your breast one time and your father was an alcoholic and then your parents got divorced, now you have 3 ACEs and you're going into the area where you have severe outcomes. On the other hand, if your father had sex with you for 10 years, you'd only have 1 ACE and that would appear to be less. So who knows if that's true? We don't know. We don't know if that's what we really believe. And there have not been studies that look at severity or length of time of a trauma or anything along those lines. Much harder study to do, and it hasn't been done yet. The original study, the people who did the original study went so far as to say that if you had 4 or more ACEs, you had a 20-year less life expectancy than if you did not have them. But one of the other things that the ACEs study doesn't look at is the rest of your life. So you're having these adverse childhood experiences, but you're also having other types of things happen in your life during that time and afterwards. For example, Bruce Perry, one of the stars of our profession, states that what predicts the health outcomes and the social functioning outcomes more accurately than just the number of ACEs is what social support did the child have during the time those ACEs were taking place. Another thing that has not been studied is what about going to therapy? Does it help your health outcomes if you go to therapy? Again, that would be a hard thing to study because what does go to therapy mean? So we don't know the answer to that. So the ACEs opens up lots of other areas of research. So many people, when they see the ACEs questionnaire, get a little worried about themselves, because many of us in the field also have 4 or more ACEs. What does this mean for our own health and our own resiliency? There's actually a website that is called ResilienceTrumpsAces.org, because there hasn't been a study about the health outcomes of children who had adverse childhood experiences but also had some resiliency factors. So we don't have this quantified yet, but there has been a lot of study of resiliency, of why some people are able to thrive even after growing up in a difficult situation. This research overwhelmingly shows that one person can make a difference. That if a child has one person who cares about them, goes to their games, remembers that they have a test and asks them how it went, sees the best in them, that one person can make a difference in them being resilient and not being overcome by their ACEs. And that one person could be you. Furthermore, there's other resiliency factors. One is an area in which the child feels that they have control and that they can make a difference in their life. Also, that they have opportunities to learn skills and to learn emotional regulation. So an example of both of these would be a child who belongs to a team and who is well appreciated for their skills in that sport, has access to a coach who cares about them. And of course, in order to participate in the sport, they have to develop emotion regulation skills, and they also get a sense of belonging to a group. That could be a huge resiliency factor, which makes a difference even though that child is experiencing adverse experiences. Another area that can help is belonging to outside communities, such as a religious community or cultural communities in which there's a sense of hope. Still, the ACEs study is extremely important. John Breer said if child abuse ended today, in 10 years the jails would be empty and the DSM would be a pamphlet. Whether or not you believe that, the study shows us how much of the money we spend today on treating medical illnesses, plus, of course, the distress and heartache they cause, how much of that could be eliminated if we would just do some prevention and just help decrease the number of ACEs that children experience. So give this some thought for yourself. Supposing you personally were given a grant of $5 million to decrease the ACEs in your hometown, to make children experience less adverse experiences. What would you do? What would actually help? If you think about this, you'll see that social issues and social conditions would be essential to consider. So this ACEs study is very important. Trauma is a public health epidemic. We're just beginning to see the roots of poor health in adults that are formed in early childhood. We're just beginning to study the mechanism of that connection. If we can intervene early and do prevention efforts, it's much cheaper, easier, and it has ramifications throughout the child's life, throughout the adult life. So if we would address trauma at the child level, and then we could help prevent illness at the adult level. And by the way, it's important to notice that the ACEs study shows that it's dose related. That is, the more ACEs you have, the worse your health outcomes. Almost all the people we meet as clients already have a certain number of ACEs. But if through your work you can help prevent them getting more ACEs, you're giving them a gift of health. You may be giving them more years to their life. For example, if you were treating a kid who was in foster care and who had been moved around and abused in foster care, but through your treatment of him and your advocacy for him, you were able to get him settled into a home where he could stay and not have any more ACEs happen to him, what a gift you would have given him in better health throughout his life. So we want to provide trauma-informed care because we don't want what we're doing to give the kid more, or the adult more, bad experiences. We want to provide care that's respectful, collaborative, compassionate, and flexible.